It's me, Dr. G. I'm back in the office this week, seeing patients, and let me tell you that it feels good to be back in my element. As I've mentioned countless times before, I cherish the opportunity to lead my team in helping others achieve healthier living and more positive outcomes with any condition they are facing. It truly takes a team-based approach in this day and age to help people meet their goals. I remain grateful to my work family and professional colleagues at large. Now, if only there was a way of getting all of that darn paperwork in my in-basket to magically disappear, then I would truly be on cloud nine. So, I mentioned last week in my Friday morning round segment, check out my Facebook page or YouTube channel for the replay, and while you're there, go ahead and smash the like or subscribe buttons, that I've had time to catch up on reading some awesome medical journals during my week away. Last week I described what we know about the link between COVID-19 and anosmia, or loss of smell. This week I want to help you better understand the link between COVID-19 and obesity. I'm seeing this question come up on physician blogs as well as in the public health sphere. My patients have not necessarily asked me much about this topic, but now I am more prepared to address it. The scourge of the global obesity pandemic will only make that of the global COVID-19 pandemic worse. Here are a few quick obesity realities. Number one, worldwide obesity rates have tripled in less than 50 years, affecting nearly 2 billion people based on 2016 World Health Organization data. This number also includes those who are considered overweight. Number two, obesity reduces lifespan by 9 to 13 years, and in the US alone, greater than 300,000 deaths annually are linked to obesity. Number three, obesity increases the risk of cardiovascular disease, type 2 diabetes, hypertension, dyslipidemia, obstructive sleep apnea, chronic lung disease, and some cancers. I've included links to past To Your Health with Dr. G episodes that address some of these specific topics in the post. So, how does obesity relate to SARS-CoV-2, you ask? We know for a fact that diabetes, cardiovascular disease, and lung disease are the most commonly reported diagnoses that predispose individuals with SARS-CoV-2 infection to require hospitalization, including an intensive care unit stay. Published on July 9th in the International Journal of Obesity, entitled Obesity, the most common comorbidity in SARS-CoV-2 is Leptin the link. The authors sought to determine the mechanism behind why obesity itself is highly prevalent in SARS-CoV-2 infection. They specifically explored the immunomodulatory effects of the hormone leptin. Leptin is a hormone produced by fat cells, and the more fat a person has, the more leptin that circulates in the body. At a functional level, leptin regulates appetite and metabolism. However, leptin also regulates the cells that fight infection. High levels of leptin promote a low-grade systemic-wide inflammatory state and can impede the body's ability to fight off infections. When you throw in an infection, COVID-19, which already makes it harder for the body to fight it off, then you find yourself in a difficult position. Obesity plus high leptin levels plus weakened immune system plus SARS-CoV-2 plus already likely having an obesity-related medical comorbidity. You see where I'm going? Yes, the potential for disaster runs high. The authors conclude that more studies need to be done to determine how obesity specifically causes less infection-fighting cells to become activated and why these cells, when activated, die more quickly. Make no mistake, most people with a body mass index greater than 30 do not necessarily think of themselves as being at risk for COVID-19, but they do need to absolutely be aware of this correlation, whether they have an obesity-related comorbidity or not. The best thing that we can do is to educate our patients who are overweight or obese to take the necessary steps to adopt healthier living strategies and to take advantage of any positive opportunities that have come their way. We do not want to stigmatize or even marginalize this population of people. Both physicians and patients need to set aside any insecurities or preconceived notions about obesity care in general in order to reduce COVID risk and improve health outcomes. Optimal obesity care is best addressed in a holistic, compassionate, collaborative, and non-judgmental way. Peace out.